Hey everybody, March 31st, 2020. Yesterday evening, Monday, we had the very upbeat, the very pro-America press conference with the task force featuring what America is doing to solve this problem, not what our government necessarily is doing, but what we all are doing. So what I want to talk about right now are the masks, and two major developments there. One is factories like My Pillow shifting and building, fabricating N95 breathing masks. They're a company that they make pillows, so they deal in fabrics and sewing, elastics, whatever. So it's make a pivot, make an adapt to what you're doing now, and you can build breathing masks. So they're doing that. They're claiming tens of thousands. I'm not sure the exact availability. They may be shipping already. I'm not sure. The next thing you heard relative to masks was at least one company, but a handful, 2 or 3 locations sterilizing the N95 masks that we have in place. So what does that mean? So that sounds good, okay? You have, instead of throwing them away, the healthcare providers can, send them in. They can be sterilized and reused. Now, again, very good. So you have two things that seem to be in competition, right? Do we really need to sterilize them if the manufacturers are building tens and tens of thousands? But that's what the free market gives you, okay? That's, sometimes you get hurt. You start a business and you go out there with a great product and someone just comes out with some better thing and just crushes you. But in the end result, the people benefit, okay? So with competition, people trying to outdo one another. And in this case, it's not all profit motive. I don't think My Pillow is making money on it. And for all I know, they may be donating the masks. But, and I'm not sure that they stopped building pillows. They may have taken a segment of their factory and their people and invested in that. So there is that compassion element. There is that, we're going to help people element. This isn't just capitalist for-profit business that we're talking about. But let's talk about more of the sterilization. So from what I gather, the sterilization is using vapor phase hydrogen peroxide. That's a low temperature sterilization method. They use toxic gases and vapors and things that kill the bugs. So one of the downsides I picked up on right away was, wouldn't it be better if each hospital could sterilize their own masks instead of, shipping them all the way to Ohio and having them, now, the president cited they could sterilize thousands or tens of thousands of masks at one time. So that indicates a big sterilization chamber. The hospitals, they each have sterilizers. Most of them, if not all of them, have vapor phase sterilization going on. But so shipping them to one central location is not necessarily the best way to fight the virus. It is a good kind of recycling. It will increase the supply of masks available between manufacturing and recycling. Now you have more masks available for everyone. But so why are we doing it in one location? Well, something like this, it's similar to the Abbott where you have an existing machine and then you validate it. You may have to modify software, you may have to modify some parameters, but then you do an update, if you will, on that product, a revision to say now it can be used for COVID-19 testing, and here's how you do it. That has to be validated and approved by the FDA. Now, we know the FDA can do that quickly under the emergency use authorization, but for now, it's safe to assume that this company doing the bulk sterilization of the masks has had their process validated. They control how much of the sterilant goes in for how long, how the devices are packaged. You can't just necessarily bunch them all together and throw them in because the vapor phase has to attach it on the surfaces and things like that. So that's been validated and that's been approved. Now, the manufacturers of the smaller sterilizers that are in the hospitals, there's only a few of them out there. I'm certain that they're looking at this and working on it as well. So I shouldn't say certain, but confident. I mean, if I were in that business, I'd be looking at it. So that could be the very first step towards each hospital being able to sterilize their own masks. One issue there to make that non-ideal might be, well, you know, they need those sterilizers for sterilizing other instruments and other things. That is very true. However, if the hospitals have stopped surgeries and focused everything on COVID-19, that might become a possibility. So even if the hospitals were able to sterilize these masks on location in their existing sterilizers, that doesn't mean that the large bulk sterilizer company goes out of business and, you know, they don't have a business case. It's good. There could be a benefit to both. You know, well, obviously it's better if the hospitals have the option. They can do whatever works best for them. So if they're in a situation where they have plenty of supply of fresh masks and they don't want to dedicate resources to, or they can't dedicate resources to sterilize them, they can be using their fresh masks and basically recycle the used ones by sending them off to be bulk sterilized and put back into circulation. This isn't our government, okay? The role of our government in this is our FDA just making sure that, you know, this stuff's validated and approved, and we have a way to fast track that for the emergency use authorization. But this is really the free market doing all this. So, you know, it's not, you can't really compare Chinese government to U.S. government. If you want to make the comparison, you got to say, this is what a Chinese government, an authoritarian government did and can do, but this is what a free market with the government can do in response. And we're doing a lot, and guess what? We're preserving individual liberties and freedoms. So I'm psyched. I'm excited to see what our country is doing, not our government. Okay, be blessed. Talk to you soon.